I'm Kaylee and I'm going to do basic IV insertion today. So first we have to prepare our medication in our INT tube. So I'm going to draw up 3 milliliters. Okay, make sure that you don't have any air bubbles, just flick it a little bit. And then we're going to change to our needleless device. And then we're going to irrigate the INT tube a little bit so you're not pumping any air. See little drops coming out the bottom. Alright, so now we're moving on to the actual insertion part. So the first thing you need to do is you need to pick your vein, and I'm going to pick this one because all these aren't really good ones. So this is the most distal one and it's spongy. So we're going to put on the tourniquet with a simple slip knot. Maybe. Okay, and then you're going to check the pulse. Alright, the pulse is good. So now we're going to put on our gloves. Open another alcohol pack and we're going to clean the site. You do it in a circular motion outward. Then you let that dry for about a minute or so. Now we're going to do the actual stick, so always tell the patient, be careful, it's going to be a little stick so they're prepared for it, not jumping around when you stick them. So you do bevel up, you hold the skin taut and you go in at about a 50-degree angle. You'll feel a little pop when you hit it. And then I'm observing flashback. And then you just go ahead and put the catheter all the way in while you're pulling the needle out a little bit. And at this time you can release the tourniquet. Okay, so now you're ready to attach this. You hold the vein, pull this out really quick, and then screw this on. Alright, so now you pull back on the syringe, you observe a little blood, so that means you're in a vein. So then you're doing the push pause method. Just putting those 3 milliliters in there. Alright, now you can detach this and put it in your needles box. Now you clean this up a little bit with a little 4x4 or a towel, which you probably have underneath because it's always bloody. Then you put your tegaderm. You want to put it to where you can still see everything. Okay, and then you would take the excess up so it doesn't get tangled or caught on anything. And then you'd put your name or your initials, the date, time of insertion, and length and gauge of the catheter on the dressing, and then for documentation at the end you'd put your name, the date and time, what arm you inserted it in, the length and gauge of the catheter, how the patient tolerated it, as well as any instructions that you gave the patient. And that's it.